Welcome to Four Directions of Wellness. I'm Roberta Diswood. Tulpahanishle, Sisakani Bushishchin, Nakaiden Edische, Hanahni Deshanelle. Prediabetes is real, it's serious, and it's reversible. However, 90% of adults who have prediabetes don't know it. With us today is Nora Benali, diabetes educator and registered nurse with Health Education Center for Wellness at Northern Navajo Medical Center. Hi Nora, go ahead and tell us about yourself.
Hi, Yate. I'll start with my clan first. I'm Tatnistani and Shloa Shi Bashichin Nakaidana Dashiche Hoan Sanai Dashinala. I'm a nurse. I've been a nurse for about 19 years and have worked most of those years here at Shiprock Service Unit.
Well, thank you for being here. So tell me, what does it mean to have prediabetes?
So basically, prediabetes is just telling us and telling your body, that you have higher than normal blood sugar numbers, but not high enough to be type 2 diabetes as far as blood sugars are concerned.
And so when you say higher than normal, what are the numbers that you're looking for?
Okay, so we're looking at random numbers for one, but ideally we like to see numbers that are kind of balanced or come back as a percentage. Mm-hmm. And in your body, you're able to have these blood sugars running around for about 3 months, and then in 3 months that number changes. So that is basically called a hemoglobin A1C. And so those numbers for prediabetes is higher than 5.7, but not higher than 6.4%. If a person is type 2 diabetes, usually their A1C numbers are 6.5 and above.
Okay, well that's good. And so how does somebody get an A1C test?
They're welcome to ask their provider if they come to our clinics. We're also able to do the test as a walk-in to our Health Education Center for Wellness.
Well, that's really good information. So I know I mentioned in the introduction that prediabetes is serious. How is it serious?
Well, for one, a person knows that they have prediabetes. They can actually reverse it. They can actually delay that onset for type 2 diabetes. And they can actually just stop it right where prediabetes ends and type 2 begins. That's the great thing about having prediabetes, is that you can do something about it now. But we have to know that we have it first. Mm-hmm. So that is the one great thing about having prediabetes. Mm-hmm.
And then also, is there anything that if you don't get your prediabetes and knowing it, but also can it lead to anything else?
Oh, right, yes. So it leads to a lot of cardiovascular diseases. So anything to do with the heart, high blood pressure, high cholesterol, high triglycerides, those are actually risk factors for prediabetes, but even more for type 2 diabetes. So the risk factors are, the more you have, the more likely you will have type 2 diabetes. But in pre-diabetes, we're actually able, and research has shown that we can actually stop going on and having the higher numbers.
So if you could tell me again, how does someone know if they have prediabetes?
All right, so there's have been several risk tests that we call them that can actually tell you if you're at risk for it and actually prompt you to go get an A1C test done, which can verify where a person is as far as prediabetes. So one of the risk tests that we have here is called Do You Have Prediabetes? And it's based on 5 fingers. So we have the 5 fingers here, and basically it's going to ask, kind of number off your fingers. And so our 5 finger test that we have is basically answering these questions. How old are you? If you're less than 40, you hold up no fingers. If you're between 40 and 49, you hold up one finger. If you're age 50 and 59, you hold up 2 fingers. If you're older than 60, you hold up 3 fingers. And then you hold up 1 finger if you're a man, none if you're a lady. If you're a woman who had gestational diabetes while a person is pregnant, then you would hold up 1 finger. If you have a family member with type 2 diabetes, you hold up another finger. Have you had any problems with your blood pressure? If you've been diagnosed with high blood pressure, then you would hold up another finger. And then how physically active are you? If you're fairly active, you'll hold up no fingers. If you're not active at all, then you would hold up 1 finger. And then the last question would be, what is your weight? If you're overweight, if you're obese, if you're more than morbid obese, so the morbid obese would be 3 fingers, being obese would be 2 fingers, and being overweight would be 1 finger.
So if someone watching took the test with us and are holding up 5 fingers or more, what can they do?
They can stop by our health education office and ask to be tested for prediabetes. And we are more than happy to order a test and to go to our laboratory to get a blood test done from their arm, from their body, to give us a number on where they stand as far as holding up more than 5 fingers.
Okay, so I know in the introduction I also mentioned that prediabetes is reversible. How can you reverse it?
Well, once a person knows that they have prediabetes and that it can be prevented from what research has shown, one of them is to actually lose weight. So we're not asking for like a huge weight loss. We're only asking for at least 5 to 7% of the current weight. So say, for instance, a person weighed 150 pounds. 5 or 7% of that would be only like about 8 to 10 pounds off for weight loss. So that's one way that has known to be a huge predictor of not having diabetes. The second one is how physically active are we? How physically active are you? And we really encourage one to be at least 150 minutes per week. That wouldn't be all at one setting, but it would be throughout the week of the 7 days. So basically 30 minutes, 7 days a week.
So they're always mentioning how exercise and eating well go hand in hand. What can they do for that?
So eating, we like to balance it with our activity, and what we put in our bodies is going to help us weigh less. So limiting our sugary drinks is a huge factor in trying to keep our blood sugars down and actually not store it. And as we're working out, as we're being active, most of those calories will come off. Okay. So that would be one of the best ways to decrease our chances.
Okay. Well, Nora, I want to thank you for being here today.
Thank you.
This has been 4 Directions of Wellness. Hagonet.